Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sayyid Abdul Qadir, a consultant psychiatrist. I would like to welcome you. It's a great pleasure and honor for me to be here on this occasion of World Mental Health Day, where we're going to talk about mental health. It's more or less a simple educational session to define mental health and to talk about some very common mental health diseases that we face day to day. And also, I'd like to touch on the point of stigma that the populations have against mental health and try to clarify some misunderstandings that people may have. Start with, let's define health. So, what is health? I'm going to go with the definition of the World Health Organization. So WHO defines health as a state of complete physical, mental, and social well-being. It's not merely the absence of disease or infirmity. So to be healthy, to be defined as a healthy individual, you have to be physically healthy and have a good state of mental health and have a social interactions. WHO also states that there is no health without mental health. So what is mental health? Mental health, as a definition, is a dynamic state of internal equilibrium, which enables us to live in harmony with universal values of society. It also contains the cognitive and social skills that we are to have to express one's own emotions and empathize with others. So empathy is basically our will and our ability to put ourselves in shoes of the other person in front of you and try to feel what they're feeling in reaction to the circumstances that they went through. Going back to the definition, also having a good mental health entails flexibility and ability to cope with adverse events in life, which is something that all of us face on day-to-day living. I wanted to start by putting in a historic perspective here about mental health and what people thought and how it all started and where we are now. So it was believed that mental illness was caused by demonic possession, witchcraft, or angry gods. And the most common treatments in those days were exorcism, getting the devil out. Another form of extreme treatments was prifening. Prifening is defined by putting in a screwdriver in your head and making a hole in the skull so that the evil spirit that is conquering your brain will have space to be released. Then as days and decades went by, in the late 1400s to 1600s, a common belief was that some people made pacts with the devil and committed horrible acts, such as eating babies, and these were people who were considered witches and were burned and killed. By the 18th century, people who were considered odd and unusual were placed in asylums. Often these people were kept in windowless dungeons, beaten up and chained to their beds, and had little and no connection and contact with the outside world. In the 19th century, despite reforms and efforts, a typical asylum continued to be filthy, offered very little treatment, and often kept people for decades. One form of treatment was to submerge patients in icy cold waters and baths for long periods of time as a form of cure. And then we had electroconvulsive treatments where people were shocked. Now, electric convulsive treatments do exist today, but in a very, very civil manner. In the past, people were just shocked. In these days, we take them to a area close to the operating theaters, And we have an anesthesiologist, we have a psychiatrist, we have nursing. We give people an anesthetic and a muscle relaxant before the procedure. So the therapy is very well known, still exists, and it's one of the gold standard therapies for treatment-resistant mood disorders, but is done in a very different way than it was in the 19th centuries. In 1954, and gaining popularity in 1960s, first form of medications came to light, which were the antipsychotic medications, after which came the antidepressants. And they proved tremendous help in controlling the symptoms of certain psychiatric and psychological disorders. And this is a very interesting point. What's important for everybody to know is that medications have come a long way and have made tremendous improvement in terms of being extremely effective and having less and less side effect profiles. Today, we have medications, as I said, with high efficacy, low side effects, and hospitalization is only for people who are severely unwell, and it is for a short period of time, after which people are sent to their homes and to the communities to be part of a community that they belong to. So what's the connection? Very important point. Going back to the definition of WHO, it says there's no health without there being a physical health, mental health, and a good social well-being, social life. So what's the connection? So the connection is as follows. Poor mental health is a risk factor for chronic physical conditions. And again, on the contrary, on the opposite side, people with chronic physical conditions are at risk of developing poor mental health. Social determinants of health impact both chronic physical conditions and mental health. So understanding the link between the mind and the body is the first step in developing strategies to reduce the incidence of coexisting conditions and support those already living with mental health and chronic physical conditions. So to make it more clear, I thought of some examples here. So if we are in constant pain, then almost inevitably means that we are going to suffer emotionally and may indeed develop mental health illnesses. There is a direct link between having chronic medical illnesses and development of psychiatric problems. Again, another example is if we have a chronic or terminally ill patient, then our mental health will be at very least at risk of deteriorating. So any illness that affects our mobility, ability to function, normally can reduce our well-being and can lead to mental illnesses. Poor mental health can mean that routine tasks such as work, shopping, cooking, taking care of our family becomes difficult. So now I'm talking about the opposite spectrum. I'm talking about people who have mental illnesses and how this is going to affect their day-to-day life and how it can make their life difficult. So we can lose the motivation if we have a mental illness, say depression, schizophrenia. We can lose the motivation to do anything and cease to care about ourselves or anything else. We may also neglect ourselves, and this can include ceasing from physical activities. People can lie in bed for days, in dark rooms, because they just do not have the ability to move themselves to do anything. Some people may resort to other forms of coping which can prove to be negative, such as excessive smoking, using alcohol, illicit drugs, as a way of dealing with emotional pain. And as we know, all these are band-aids and are not a solution to the real problem. Stress and anxiety can have bad effects on our immune system and also lead to issues with physical health. So let's talk about some statistics here, some facts about mental illnesses. So mental illness indirectly affects everyone. Every one of us has gone through the effects of mental illness, either through being affected directly or having a family member, friend, or colleague that suffered from mental illnesses. 25% of people will personally experience mental illnesses in their lifetime. And this statistic will kind of shock you. We have 450 million people worldwide currently who suffer from mental illnesses. Mental illness does not discriminate. It affects people of all ages, all educational backgrounds, all income levels, and all cultures. In every country, at least 1% of population suffers from schizophrenia. Anxiety disorders on average affect 5% of household populations, causing mild to severe impairment. Suicide can account for 24% of all deaths among ages 15 to 24, and 16% among people aged 25 to 44. Suicide is one of the leading causes of death in both men and women, from adolescence to middle age. We cannot deny this. We cannot say that our children, our spouses, are immune from suicide. There are some protective factors, such as religion for some, pets for some, but again, sometimes when you're in that dark spot, trust me, nothing matters. We have seen people in every country that I've lived in, including Muslim countries, Arab countries, non-Arab countries in the West. People have suicidal ideations, people have tried to hurt themselves, and people have successfully completed suicide. So suicide is a serious issue. It should not be taken lightly. If somebody says that they're suicidal, that's a psychiatric emergency. This message is to everybody, including parents, spouses. The mortality rate due to suicide among men is 4 times the rate of women. So basically, women have more attempts, men have more successful and serious attempts. Talking about disability that's caused from mental illnesses, WHO, the Center for Disease Control, CDC, they came up with these statistics about disability worldwide. What causes the most disability? And they had mental illnesses, physical illnesses, and 4 of the 10 leading causes of disability in developed countries were mental health disorders. And major depressive disorder was number 2 on the list. So why do people get mental illness? How do they get it? What's behind it? Mental illness, like any other chronic illness, is multifactorial. You cannot pinpoint to one cause for this. There's multiple factors that usually come together and cause these illnesses. So to start with their biological factors, then we have psychological factors, emotional factors, and then again we have social factors. All these can contribute to mental illnesses. And again, let's not forget about genetics and environmental factors. Genes play a role. If you have parents who are depressed, you are likely to develop depression more commonly than a person who doesn't. So again, somebody may have one factor, somebody may have all factors that led them to develop a mental illness. So I want to talk about some common mental illnesses, some common examples here. We have something that we call a major depressive disorder. Now, major depressive disorder we'll talk about in a bit more detail later, but basically it's what we call in lay terms depression. Then we have a bipolar disorder, well known to a lot of people. We have anxiety disorders, and then we have psychotic disorders, in which basically you lose touch from reality. A psychotic disorder is you are basically not responsible for your actions if you do something during a psychotic episode. Then we have substance use disorders. We have, again, mental health issues due to general medical conditions. So talking about depression, to diagnose depression, I'm not going to get into the medical jargon. I'm going to try to keep it simple because, again, this is an educational session. I want you to come out of it with some information that will be helpful. The reason we're defining all these, you're going to come across a lot of people. You may be able to help them. You may be able to assist them, or basically, you may be able to guide them to get help. So major depressive disorder, what we call a depression, it has two major criteria, which is basically either a depressed mood or loss of interest or pleasure in activities that you enjoyed in the past. So you can either have low mood, or you've lost pleasure in things that you enjoyed in the past, or you can have both. So some people may tell you, I'm not sad, but I stopped enjoying everything in life. So that's a sign of depression. Other symptoms include issues with weight, such as either weight gain. Some people just cannot eat when they're depressed. Some people can just, have emotional eating and eat more. That can lead to weight gain or weight loss. We have fatigue, loss of interest, loss of energy, nearly all day, most of the day. Some people suffer from lack of ability to sleep. Some people just oversleep to get over the day because they don't want to face it in their depressed manner. Some people can become very, very lifeless, not moving, just lying in bed. Some people have feelings of worthlessness, guilt, helplessness. And again, these people, ladies and gentlemen, can have thoughts of death and can have suicidal ideations or intentions or plans. Let's talk about bipolar disorder. So in bipolar disorder, again, as it says, there's two poles. So let's consider that mood is a world of its own. There's a globe. So basically, there is a North Pole and a South Pole. The North Pole is full-blown mania, and South Pole is a very severe depression. And in the middle of it, there is a spectrum, which is normal mood. So in bipolar, you have two episodes. You can either be depressed or you can be manic. Again, mania has levels. You can be hypomanic or manic or full-blown manic. So when you talk about a manic episode, we talk about, again, 3 or 4 days where people every day, most of the day, are having symptoms of mood disturbance characterized by elation, a very elevated and high mood. And this high mood, people love, but it doesn't stop there. With time, it can progress to irritability and expansiveness, and then can lead to psychosis. And also, these people will have grandiosity. They feel basically an extreme sense of self-worth that's extremely high, diminished need for sleep. It's not that they cannot sleep, they feel that they do not need to sleep. Excessive talking, pressured speech, racing thoughts a mile a minute, clear evidence of distractibility, increased level of goal-focused activity at home and work. And, and a lot of artists, musicians, and painters, singers did their best pieces when they were in state of mania. And they can also indulge in excessive pleasurable activities that can prove wrong, negative, and have negative consequences to these people, such as high speeding, indulging in, different relationships with different partners, and so on and so forth. So this was bipolar. Generalized anxiety disorder. Again, generalized anxiety disorder, people with this experience constant, chronic, unsustainable worries. They're worried all the time. And their worries are general, meaning about almost everything. Worries about health, about family, about money, about job, about work, about losing the job. Thoughts are usually mainly negative. And the worries go on day by day, on and on, possibly all day. people feel that their brain is functioning like a motor. It doesn't stop. Imagine if you had an engine that was ongoing for 24 hours, it heats up. And it leads to physical symptoms such as headaches, muscle pain, fatigue, restlessness, difficulty sleeping because your mind is still going on and on at night. And all this can lead to irritability, feeling on the edge all the time, and basically will disrupt your work and your social activities. Some other disorders that I don't want to go in detail because I'm not going to be able to cover everything, but just for you to know a little bit, psychosis. Basically, in psychosis, there's loss of reality testing. Basically, people have delusions, have hallucinations, people are following them, people are trying to harm them, all kinds of stories that are basically so real to these people that they are unshakable. And then they can develop auditory and visual hallucinations. They can see things that are not real. They can hear things. They can feel things even. Psychosis can come in many illnesses, not just in schizophrenia. You can have psychosis in schizophrenia, in bipolar, and in medical illnesses such as delirium. Then again, we talk about attention deficit disorder, in which basically there is attention deficit or hyperactivity or both. And we do have this a lot of the time. It starts in childhood, but again, we do have adults that have attention deficit disorder. They lose the hyperactivity, but they continue to have the deficit in attention, or some of them can develop it later in their life. Substance medication-related disorders also is a huge topic. We're not going to go into details, but again, substances you all know, any illicit drugs, excessive use of alcohol, smoking, tobacco, marijuana, and again, doesn't stop there. If you're abusing pain medications, if you're abusing muscle relaxants, if you're abusing benzodiazepines such as Valium, Xanax, you're again considered a substance abuser. This is the disorders in a nutshell. Then after that, I want to talk about a very important topic. And I think if you don't take anything from this presentation, please focus on this part. Extremely important, which is the stigma against mental illnesses and mentally ill people. It's sad that almost 50% of those who feel they have suffered from depression or anxiety have never gone to see a doctor about this problem. Why? Because of the stigma. They themselves have grown up in a society that rejects mental illness, rejects mentally ill people, and people are just afraid of being labeled. Stigma or discrimination attached to mental illness presents a serious barrier, not only to diagnosis, but also to treatment and to acceptance in the community. Stigma of mental illness is universal. It knows no geographic area. There was a study that was conducted in 2016 about stigma. It concluded that there is no country, society, or culture where people with mental illness have the same societal value as people without mental illness. Stigma comes in three different types. There's something called a self-stigma. A self-stigma refers to negative attitudes that include internalized shame that people with mental illness have about their own illness. Then comes the public stigma, which involve negative or discriminatory attitudes that others have about mental illness. And then we have the institutional stigma, more systemic, involving policies of private organizations that intentionally or unintentionally limit the opportunities for people with mental health illnesses. In an editorial in Lancet, which is a very well-known journal, it notes that the impacts of stigma are pervasive, affecting political enthusiasm, charitable fundraising and availability, support for local services, and underfunding of research for mental health services and other health conditions. So, what are some of the harmful effects of stigma on mentally ill people? They are socially isolated. It's not just enough that they're living in shame of having a mental illness, trying to hide it from people. But again, they're subject of social isolation. They can be banished. They can be belittled. The other main issue is lack of understanding by the people who are supposed to be the closest to you, which are family members and good friends, co-workers, and the community itself. And all this keeps people from seeking help and treatment. And even if they start treatment, they will not continue. I have seen parents who have stopped their children from taking medications for depression, anxiety. I have seen spouses who have threatened to divorce their spouses if they would take medications or even visit a psychiatrist or a psychologist. So talk openly about mental health to your patients, your colleagues, your workers. And especially, I would like to send a call, a plea to people who are in the social media, who have a lot of power and a lot of followers. Please do address this very important topic, important area of life. Again, if we allude to what WHO said, there is no health without mental health. So we cannot basically ignore or belittle or stigmatize these people and this population. Again, if you don't know, there's always resources. Educate yourself, educate others, and respond to misconceptions and negative comments by sharing facts and experiences and data that's available in abundance. Be cautious of language and remind people that words matter. We don't want to hurt people by using terms that might be hurtful, such as mad or crazy. I think we should be beyond that. Again, encourage equality between physical and mental illness. Draw comparisons to how they would treat someone with cancer or diabetes compared to depression and anxiety, which in the end all fall under category of disease disorders and cause distress to patients. Show compassion and empathy to those with mental illnesses and be honest about treatment. Normalize mental health treatment. It's just like other forms of care and treatments, because this, again, there's a huge misunderstanding where people assume that mental health treatments and medications cause addiction, cause dependence, just send people into dark places that they will never recover from. And this is a question that I normally get when I propose treatment. But again, let me reassure you that most of our medications are very safe and have reached to a very high level of effectiveness and less side effects. And there are some medications that might have the potential for dependence, but rest assured, your doctor will warn you and let you know. And if you take it under guidance of your physician, then you will not fall into the trap of dependence or addiction. And also, let media know that when they're using language, stigmatizing the mentally ill or presenting stories, that's not helping the cause. Media is a power that could and should be used in a positive manner to help people, not do the opposite. So the take-home messages are basically mental health does not mean that you're crazy. Mental health disorders are just like any medical disorders. They require care and treatment and empathy. And again, let's educate ourselves and others in the community about mental health, what mental health disorders are, and clear a lot of misunderstandings and stigma, recognize the symptoms and signs of the common disorders so you know when you or your loved ones or somebody in your community is suffering, and learn how to empathize with these people. Spread the word. Help is there. Talk to your trusted ones, family, healthcare professionals, because again, if you talk, you will get help. So please don't suffer in silence. In the end, I'd like to really thank you for your attention. I hope that this was helpful, and we will come back with more content.